Alright, so I think the audio is working on the recording this time, so hopefully when I get this uploaded you'll be able to hear it, unlike the previous try. So elastography, let's talk about it. Alright, so elastography is based on the principle that when we apply a force, it causes an object to change shape, or what we call strain. So stress, the force applied to an object, causes strain, the change of the object's shape. We're familiar with this with the piezoelectric effect, where we apply a force of electricity to a crystal, and this causes the crystal to change shape. In elastography, the force that we're applying is pressure, and we're measuring the strain, the change in shape, with various tools. So we'll talk about those tools in just a bit. So elastography is the measure of strain from stress. It can be displayed as a color gradient, a number indicating the units in pressure, the slope of a gradient in a specialized case that we'll go into. So there's four types of elastography that we're concerned with. There's a fifth type that we're not going to worry too much about. I'll introduce it, but I'm not going to spend much time on it. So there's four types. Strain imaging, which is you push down with the probe and you get a picture that changes color. There's acoustic radiation force imaging, which we call ARFI. ARFI is same as strain imaging, but it utilizes an automated force of the acoustic radiation from the pulse. Then there's shear wave elastography imaging, and that is the one that is most machines are going to. And then there's something called supersonic shear imaging, where shear waves move through tissue at supersonic speeds. We'll also talk about that. So the history of checking to see what things are by how hard they are. This has been palpation. We've pushed on people's bellies for years to see what's going on, and sometimes you find a hard spot, and that has been determined to be in many cases that's what a cancer is, because hard growths are often cancers. So palpation was first recorded as a medical technique back in 1500 BCE in Egypt, and Hippocrates wrote about utilizing palpation to determine diagnosis in 300 BC. But it wasn't accepted by modern medicine as a diagnostic tool until 1930, which seems a little late in the game. In 2007, at the Radiology Society of North America, there was a report on elastography where they looked at benign lesions versus cancerous lesions, and it had an over 90% specificity to identifying benign from malignant lesions by elastography. Current reports have been a little bit more conservative in saying that there's an 86.5% sensitivity and an 89.8% specificity, with an up to 99% negative predictive value. So that means when we say that with elastography it is benign, it is negative, that means that 99% of the time when we say that, we are correct. It is actually negative. So that's a huge negative percentage, and it also affords us, with a 99% certainty, we don't have to do a biopsy. So what exactly is elastography? It's a medical imaging modality that maps the elastic properties and stiffness of soft tissue. So we could re-say that as just, it's a picture that shows how hard the tissue is. And so elastography, we have a lesion seen in this picture on the left, and it's hard to tell if this lesion is a benign fibroadenoma or if it's something significant. If it's hard, it's going to be something significant. And then when we look at it on elastography, we not only see that the lesion is slightly bigger than what we were expecting because the hardness extends beyond the boundaries that we see on the ultrasound, but we can see in this scale that's here, this hard to soft scale, that this is in fact a hard lesion. And so with the hard lesion, you would be very concerned that this would be a tumor, a malignant tumor in fact. So how does it work? Well, we apply a force of some kind, and then we measure the amount of strain that is produced in the tissues. So if you have hard objects, when you apply your strain force downward, they're not going to change much, but a soft object will change considerably. So strain is how much these objects change under force. How does it work? Well, there's something called a stress-strain curve, and this gives us something called Young's modulus. You don't have to worry about what Young's modulus is, but this is also known as the bulk modulus. Now you probably remember the bulk modulus from physics, if you remember your physics at all, and the bulk modulus is simply the stiffness, the hardness of a material. And of course, as we recall, the hardness of material is related to how fast sound travels in it. So we have Young's modulus, which is a graph which measures the bulk modulus, which gives us the stiffness. And of course the reciprocal of the stiffness, the opposite of the stiffness, if you will, is the elasticity of the object. And so the elasticity of the object is how easy it squishes, to use a technical term. So we can do this in medicine with both ultrasound and MRI and get good results. So here's an example of strain imaging. You can see that when a force is applied to a soft object, it will deform, and the hard portion within it, this almond, does not deform. It just stays the same shape. And so here we see that again with this phantom. We see a phantom with a hard center in it, and that hard center does not deform, but the soft areas around it do deform. So that's strain imaging. What we do with strain imaging is we push down with our probe and we take a picture of those changes that occurred when we pushed down with the probe. Now strain imaging is really good. It was the earliest elastic imaging technique that was developed, and again, by using the probe to push, we're applying external compression, and then we take pictures before and after compression and compare them together, and the areas of relative strain deformity are shown in color. And we do that with a qualitative stiffness map. And what I mean by qualitative stiffness map, when you look at this color map here, it has hard, and the other end it's cut off, but it says soft. Okay, so blue is soft, red is hard, and that's all it tells you. It doesn't tell you how hard or how soft. It just tells you that relative to the soft stuff, something else is hard. The advantage of this is that it's cheap, it's colorful, it gives us some information, but unfortunately, because there's no numbers associated with it, it's very difficult to reproduce and gives us only qualitative information. So we get no quantitative stiffness data. So it means if you go to another laboratory and they do the same test, the results may be different just because of the way that it was performed. So there's no data to say, well, this is hard by so much compared to that. It is just simply a color. It's just colored. Some of the other problems with it is when you push down on material, they move out of the plane during compression. So you're looking at it, you push down with your probe, and it's gone. You know, it went off the plane, and we don't see it anymore. Another problem is with deep structures. You can push really hard on some bellies, and you're not going to apply much pressure to structures that are 10 to 20 centimeters deep. So there are some issues with strain imaging. But when we do strain imaging, we find out that it does show us elasticity or stiffness of tissue. And so if we look at the elasticity, we see that things that are very elastic, very compressible, like fat, mammary glands, fibrous tissue, will show up in the very low range of how hard it is. And then things like carcinomas show up in the high range. So these are hard things. Benign things tend to be soft. Okay. So in this picture we see hard things are colored white, and soft things are, no, hard things are black, soft things are white. And honestly, these pictures don't give me much information. It just says this is a little harder than the tissue around it. This one looks like it's saying it's much harder. But it does provide some information. Now, the next type of imaging we talked about is the acoustic radiation force impulse imaging. And so RF imaging is where a pulse of sound pushes this tissue, and the amount of displacement along the path of propagation indicates stiffness. This provides us with some qualitative data, actually a measurement of stiffness, and so we can make a map of that stiffness by using successive pulses, or we can just put in our sample volume, take a measure of the hardness within it, and display it out on our machine. And this is a picture from the Philips machine in the lab, and it's showing you that the hardness, in this case it is 1.99 meters per second. Now, you probably don't think meters per second is a measure of hardness, but if you remember, the speed of sound in tissue is related to its hardness. So by saying that it's 1.99 meters per second, we're definitely saying how hard it is. And we're also saying how fast the speed of sound in it is. Now, elastography, if we look at the strain elastography, again, a pressure is put straight down on the object, either RF or physical pressure. With shear wave elastography, the next type we're going to talk about, a pulse goes into the tissue and it creates shear waves which radiate sideways. Okay. Now, previously we've talked about shear waves are generated in our physics class. We discussed it, and they cause fluid to move within cystic structures. But this is a diagram showing you exactly what a shear wave is. We have a pulse going straight down, and then side to it, moving laterally, is what we call the shear wave. So with shear wave elastic imaging, we utilize a push pulse made by the transducer, and it goes into the tissue, and as it goes deeper, then the shear waves push sideways and imaging can be done. If you think about a pond or a bucket of water, when you drop a rock into it, the waves move sideways from the rock. Well, this is the same technique. So as the pulse goes deeper, the shear waves push sideways, and then we can do this imaging with either ultrasound or MRI. And we use a single push to create an entire elastic map. We don't have to do multiple pushes like we did with RF. We just do one. And this is a very reproducible and good way of getting nice images and quantitative data. The last type of imaging that we're concerned about is supersonic shear imaging. This uses the shear wave elastic imaging technique, and it creates multiple near simultaneous pulses to create a source of push shear waves that travel at effectively supersonic speed. It can detect shear waves more than 10,000 frames per second, and so for deep organ imaging, this is the way to go. This provides quantitative data on the hardness, the viscosity, anisotropy, and everything related to describe tissue properties. And it's a significant improvement for the classification of breast lesions. We found that the use of SSI has improved the analysis of breast lesions greatly. It's a very reproducible type of imaging and can travel from one lab to the other, and you should get almost exactly the same images when you go using different equipment using the same technique. So this is just showing you the analysis that was done determining the difference between benign and hard lesions, and out of a set of 36 lesions that they looked at, only one was indeterminate or misdeterminate. Almost all of the benign lesions were softer than the hard lesions. So that's pretty good numbers. Now, the last type of elastography that we're going to talk about is called transient elastography, and this is known as a fibroscan device. And this is used by some internists that take it and measure the hardness of a liver using it, and it gives them a slope that tells them the hardness. So in the top one you see this gentle slope. It's 3 kilopascals of hardness, and then this much steeper slope here is 40 kilopascals of hardness. And so a lot of internists are buying these type of machines because it allows them to do a quantitative image of the liver, or not image, but a quantitative analysis of the liver. But it does not give them imaging data, it just gives them these slopes, but that can tell them whether or not there's a cirrhotic liver because of the hardness of it. And so it's useful for that reason, but it's non-diagnostic. So this uses an actual mechanical device, which if you think about if you were to just push with your finger on a person's liver, that's a mechanical push. This actually has a plunger on it that while it's using ultrasound to measure the stiffness, this plunger comes out and pushes the liver, and they get this gradient scale which tells them how hard the liver is. It's reimbursable under Medicare, so a lot of people use it. Magnetic resonance imaging is the other type of imaging that can be done besides ultrasound, and we can see that magnetic resonance uses the shear wave technology and produces elastograms. Okay, so again, it's very similar to the ultrasound technique, but it's not limited by bone or air such as ultrasound is, and it can do a full organ imaging. So it's in many respects better than ultrasound. It has very short acquisition times compared to most MRIs, and is somewhat useful. So our applications of elastography are breast imaging. So if we're looking at these images here, we're trying to tell if one of these is a cancer and one of these is not. And under elastography, it turns out that this lesion on the right is the cancerous lesion, and this lesion on the left is non-cancerous. So the BI-RAD score can change up or down depending on the hardness of the material. Let's see if this has a... So when we look at this picture that was on our left, and we look at the elastogram that goes with it, you can see that the tissues are all in the soft range up here. And then when we look at this nodule that was on the picture on the right, and we look at its elastogram, we see that not only is it hard, as you see here, but then there's a second nodule that was missed on the ultrasound down in this area. So this is actually multiple tumors within this image. So now here we have two images of what are potentially fatty livers, and how can you tell if they're fatty livers? Well, a fatty liver is going to be harder than or softer than a normal liver, but if you look at these, which is the fatty liver? Well, obviously this one, you have poor penetration due to the amount of increased attenuation due to the fatty liver. But it turns out that with elastography we can tell that both of these are fatty livers. In renal transplants, the elastography can be used. You have to have some type of quantitative measure to do a proper renal transplant elastography. So that implies that you must use some type of shear wave imaging. And the increased hardness is associated with transplant rejection. So it's a very good method to start seeing transplant rejection. This looks like a normal kidney, but if we continue to monitor it over time, we can tell if it's starting to be rejected because of the increased hardness in it. Other renal imaging that we can look at is chronic renal disease, the increasing hardness. The kidneys get harder as the patients age. Fibrosis and tumors, we can look at it. So in this image, they're looking at what is potentially a mass or a column of Burton in this kidney, and when they do elastography they see that the softness is the same between the outer cortex and this potential column of Burton, and so we can then call it a column of Burton. There's no problem with it. Other applications, this is MSK looking at what is possibly a lipoma just underneath the skin, and so when we put elastography on it, we see that it's actually very hard. Now it has nice rounded edges, so we would think that that was not necessarily, it looks benign because of the round edges, but under elastography this is a very hard nodule and therefore at high risk of being a malignancy. Other applications, you can utilize it in imaging things like the shoulder. So here we see a normal supraspinatus tendon with the deltoid muscle above it, and when we put elastography on it, we're able to see not only the supraspinatus tendon with the deltoid muscle on top of it, but the very soft subdeltoid bursa, which does not have fluid in it, but we're able to see exactly where that subdeltoid bursa is using elastography, and it just does not show up on the ultrasound exam. Here are some other examples of looking at bursa under ultrasound. I'm going to try to lighten this up just a little bit. There we go. So we can see the tendons in the rotator cuff, and with the elastography you can definitely see the bursa over the top of the tendon. And then also what we're seeing here is an area of anisotrophy, and the question becomes, is this anisotrophic tendon, or is it a fluid where the tendon used to be due to injury? And when we look on the ultrasound, we see that there it is soft, so it is the fluid. And so this is actually a torn tendon that we're looking at, with the normal tendon being much harder. And then one of the uses of the ultrasound is to, with MRI, MRI, not ultrasound, we can look at the brain and see lesions within the brain under MRI. So even though it's surrounded by hard bony structure, using an MRI, you can still identify tissues that are hard and thus malignant using elastography. So our conclusion is that elastography is an effective means to measure the strain of tissue under stress. It is a qualitative technique. Strain elastography is a qualitative technique, but we need quantitative techniques in order to do certain diagnosis with it. So we have shear wave elastography, which is quantitative, but can also be applied to get qualitative imaging. And then SSI, or supersonic imaging, supersonic shear wave imaging, is currently the most advanced technique available and the most reproducible. And that concludes our short lecture on elastography.